Today is our 8th Neuropsychiatry National Conference we have here in Stoke, and it's really refreshing to see lots of colleagues from different disciplines. We have neurologists, psychiatrists, therapists and psychologists. We have a number of lectures and workshops. People can choose what they want to attend based on their training needs and their interest.
Having this type of conference to think through some of the challenges and look at solutions for how we continuously manage and deal with some of these challenges that are being thrown at services can only be a good thing. And I'm hoping that we will continue to have these opportunities in the years to come to have more neuropsychiatry conferences and bridge the gap between neurology and psychiatry, but more importantly, enhance the services that we provide for our patients.
I think my favourite session was the talk about women's brain injury within the criminal justice system, and how actually it's a really undiagnosed and under-recognised condition. And I think the prevalence was really shocking, and I think that it's something that it's talks like that and speaking and being able to have conversations with those kind of professionals that really draw your attention to the things that we miss often and the questions that we need to be asking, particularly in that client group who will be more exposed to domestic violence, drug and alcohol use, and actually thinking what effects has that had on the brain and how does that inform our history taking, our risk assessment, and also what services we're signposting them to. It really helps to tailor our interventions really, and how we carry out our assessments for these patients, and overall will hopefully improve our patient outcomes because we have more knowledge on how to assess and treat them.
Today has been very informative. We've sat through interesting talks and workshops. It's raised a few thoughts in my mind that is going to enable us to have a few discussions when we get back to our organisation, which supports adults with an acquired brain injury. The discussions have been clear and, as I said, informative. We've also had the opportunity to talk to other organisations behind me here who've brought their stalls, so we've learnt more about what's going on in our area. So it's also been very enjoyable.
I'm really grateful for all the speakers who supported us, and some of them travelled really long way. I'm grateful for our delegates, of course, and our sponsors and exhibitors, but most of all I'm grateful for our patients and families. They actually designed the logo of the conference, and they are very supportive of this event every year.